You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. This is an extreme makeover edition. With us, we have LA's general dentist, Dr. Melanie Marshall. Dr. Marshall, welcome to the program.
Thank you, Randy. Thanks for having me.
Now, we're talking about general dentistry today, but you say that there's a lot of advances and that a smile can really make a big difference in a person's life. You believe that?
Oh, yeah, most definitely. Very small things that we can do will certainly change a person's smile, and in a really fast amount of time.
Okay, good. Now, for people that don't know your practice, because I guess you do a lot, this concept of doing everything under one roof. Like, who's the typical patient? What are the different services that you offer?
So my typical patient is someone, it's been a little while since they've been to the dentist. When I ask them, they hesitate, they say a few years. Turns out it's been like 8 to 10 years since they've been to the dentist. Maybe some things are starting to happen, teeth are breaking, they're feeling a little bit of pain, and so I'm there not to make them feel bad. I say, you know what, that happened, your tooth broke, you got that other tooth extracted, but let's move forward. What can we do today? How do we make it better? Some of the services that I provide, I do whitening. So for people, they drink a lot of coffee, you know, it's LA.
Is whitening popular? Like the most popular?
It's pretty popular. It's something small, right? That we can do pretty quickly. And so it's LA, a lot of people drinking coffee, tea, they got to stay up, it's fast kind of pace. And so we bring them in, we do whitening in an hour, and boom, their teeth look so much different. So a wider smile just really changes people. I've got a patient, she's in her 60s, actually she's in her 70s, and she's still working. And she said, you know what, Dr. Marshall, something's going on. My teeth, they don't really look as great, and I don't want people to judge me. I don't want them to know my age. I want them to know that I'm able to work. And so I said, you know what, let's do a little bit of whitening. And it really just changed her smile. It took years off of her face. It really did. Other services that I provide, I do cosmetic dentistry. So people think cosmetic dentistry is something special, and it's really not. Everything that I do is cosmetic.
Okay.
If I'm going to put a crown on your tooth, I'm going to make sure that it matches your other teeth. Some people say, oh, well, you know, that's in the back. No one can see that. Guess what? They can see it. You're laughing, you're smiling, you're joking, and you do this one thing, and people can see all the way in the back of your mouth. So everything that I do, it's got to match. Or it's got to go with whatever our plan is. I'm not going to put a super white tooth either, because then it makes it look like you got a chiclet hanging out in your cheek.
All right.
It's ugly. I also do root canals in my office.
You know, everybody seems to be afraid of root canals. So is that like the most painful thing in dentistry? Is that why everybody's afraid of it?
That's the misconception, Randy. People think, oh, I got to get a root canal. It's going to be a lot of pain. Well, we can, I've got a license for oral conscious sedation. So I can give a person a pill. We do the root canal, and it's basically painless. They don't remember what happened. You know, it's a root canal. Other things we do in the practice are Invisalign and invisible braces. So that's for the person, they've worn braces, they didn't wear their retainers, and they're just starting to see that tooth move, and it's starting to bother them when they look in the mirror. That's something that if we catch it, I can move it pretty quickly, and they're back to normal.
Now, the lower teeth, they seem to get crooked first. Like, once you get about 40 years old, it seems like those lower teeth start to move.
Yeah.
Is there any truth to that?
There is a little bit of truth to that, definitely. But we're able to step in and move those teeth back, and people love it.
And that now these invisible braces, like clear brackets, those kind of things.
Clear brackets, you really don't even notice it. My husband, he was in invisible braces for about a year.
Did you make him do that?
I did him, yeah.
Did you make him? Did you say, look, because a husband of a dentist cannot have crooked teeth, right?
It was time. I had to kind of push him into it. But his coworkers, they didn't even realize that he had braces on. And then he got them off, and they're like, oh, hey, your smile looks nice, you know? And that's exactly what we're going for.
So Invisalign is hot right now?
I'm in Hollywood, right? No one wants to have brackets. They've got auditions. They need to look like themselves. So they're able to, I put some little attachments, the same color as your teeth, snap in the Invisalign, and you change them. They're just that simple. And they're changing them once a week, and patients love it.
Now, is this true? Because you're in Hollywood, right? I've had people say that when somebody wants to be an actor, actress, they go to Hollywood, the first thing their agent says, fix your teeth.
Yes.
Is there any truth to that?
It is so true, because their agent is seeing things on the camera that they didn't even realize were happening with their smile, their mouth, their appearance. And so their agent is just slowly tweaking things And of course, yeah, the teeth are the first thing that they want to do. And of course, we do a lot of contouring. And what I mean by that is if you've got a chip, why don't I just smooth it down a little bit? Sometimes people come in and they notice that when they smile, the two front teeth, like, why does this tooth looks longer than the other? Maybe I need to do a little bit of crown lengthening, kind of shape the gums in a way that makes the teeth appear the same length. Because, not everyone's got money for a veneer, but they've got a little money for a little contouring. They have money for a little bonding. So that's what I try to do for my patients.
Now, I have an employee. She doesn't mind me bringing this up because I said I was going to, but she has a little bit of a gap in her front teeth. I didn't even notice it, but she says she doesn't smile because of it. She says it makes her look like a kid, like a young person. And I said, why don't you get it fixed?
Yeah.
And it's her fear of the dentist.
That's something that we can do. It's such a small thing that we could change. I could put a little bit of bonding and close that space. Some people really like their gap. I had one patient, she said, well, I like my gap, but maybe we could make it a little bit smaller. Sure, why not? Let's do it. It's just a matter of the patient telling me what they want, and then I can fix it.
Is it tricky for you or technically demanding to get it right?
It is a little bit. It's definitely more straightforward when we're doing porcelain veneers because that allows the lab to shape it exactly the way we want to. But I can do that in the office. I did it for a lady not too long ago, and she loved it. Absolutely loved it.
So you also do wisdom teeth?
Yes, I do wisdom teeth frequently. Some people think that you can only go to an oral surgeon for wisdom teeth, but I've had additional training, and I also do the oral conscious sedation, so it's a perfect thing for them to do in my office, and I might even be able to save them a few bucks because I charge less than the oral surgeon.
I've had your aunt on the show. She is a dentist. We had her on the show talking about dental implants.
Yes.
When she told me about you, one of the things she referred to you as is like a super specialist.
Yes.
That you're able to do a lot of things. Elaborate, because this is like a new trend maybe in dentistry.
I go to a lot of continuing education courses, and I make sure that I have that knowledge. So whatever they need, I try to have the knowledge to do that. Of course, I still use my specialist if I need it, but my patients really don't want to go to someone different.
Well, nobody likes going to the dentist.
Yeah.
I mean, look, you seem very nice, right? And people need to know, I'm trying to not to side with you. I'm just asking the questions. But do you still hear it? Like, no offense?
Every day.
Really?
Every day.
What do they say?
Well, you seem really nice from your pictures, but I don't like the dentist. I never have. I just get so nervous. I just get so anxious. And I tell them, maybe you need to be sedated. Let's consider that.
And you don't have a funny comeback after all these years?
You know what?
No offense,
I don't.
Doctor.
I haven't. I think what I'm most excited about is replacing missing teeth with implants. That's the best thing that we can do. That's the standard of care nowadays. Before, we used to do bridges, and nothing against bridges, we still do them. But in order to do a bridge, I have to basically whittle down the tooth in front and the tooth in back.
So if you're just missing one tooth,
right,
you have to carve down the two
teeth on the side, exactly, in order to put a bridge. And so what better way to preserve your other teeth than to just put the implant in the missing space? And I use small diameter mini dental implants to do that. So we place the mini implant in, we allow a little bit of healing time, and then we put our crown on. And then you get to save those other teeth. And the other thing about mini implants is that they're a permanent replacement for that tooth. And they cost about half the price of the conventional implants. And that's another reason why my patients have really gravitated towards them.
Now, what about bridges? I mean, what costs more, a bridge or, if you're missing one tooth, a bridge or the mini implant?
Normally the mini implant, you end up coming out paying less with a mini dental implant and a crown than you do with a bridge.
Then why doesn't everybody do it? I mean, because logically it makes sense. Get your tooth back.
I think people are scared. They have told themselves that they can't get an implant. Maybe a dentist has told them you don't have enough bone for an implant. They think it's going to be too expensive. I can't afford that. But when they get in there, I'm able to see, oh, you have plenty of bone. Instead of adding a bone graft onto their bone, letting them heal for 6 to 9 months, why not place an implant that's the size of their bone instead of having to add on?
Now, you're a dentist, so you probably think that the smile is the most important thing, or one of the most important things.
Certainly one of the most important.
Let me hear your opinion.
It shows people who you are. It's what you present to the world. And I can't tell you how many patients I meet them in the chair, they're sitting there, they've got their mouth closed, arms crossed. And then when they open up and I get to know them, I realize what was missing. They wanted to improve something about their smile, and maybe that's why they weren't so outgoing. I had one patient, really nice lady, very soft spoken. She really didn't speak a lot, and she really kept her mouth kind of closed. And then once I started to do my examination, I realized, look, you have a partial in your mouth and it's just glued in. And so we gave her some mini implants and we locked in her denture, and she really had a great experience. In fact, she was at work one day and her coworker said, "Oh, I noticed something different about your teeth." And she said, "Oh, I got veneers." And her coworker said, "Oh my gosh, that's great." And she and I laughed because we know she wears dentures.
So you just gave her like a cosmetic denture, like you upgraded her denture or locked it in?
Yes, I locked it in. And so she got about 6 mini dental implants on her top of her gums. And we were able to lock in her denture, and she loves it. She's never felt better.
And people think she has veneers.
And they think she has veneers now. Back to the question about how I think the smile is very important. When you go to an interview, you want to be able to smile. I mean, who are they going to hire? The person that's sitting there, they're not smiling, or someone who seems outgoing.
Yeah.
They're giving it their best smile. Their teeth are nice and bright and white. You know, people really do judge you when you have bad teeth.
Do you see changes in their personality when you fix their smile?
Certainly, yes. They really come out of their shell. They start talking. That lady I was telling you about, she's chatting so much, I got to get her out of the office because I'm like, we got to go. So also, when you want to make someone look like they don't have any money, you know, we're in Hollywood, right?
Yeah, the movies do this.
In the movies, right, they'll take out someone's tooth. Well, what if you're just a normal everyday person and you're walking around without a tooth? We need to help you.
Are there a lot of people like that?
Oh, definitely.
And they just don't smile.
They don't smile. They really don't. They speak really low. I even have some male patients, they grow their mustache really long so that it covers their teeth.
Like the walrus.
Exactly. So then no one really notices, and they just hope to kind of just go with the flow, and they hope no one really picks up on it.
My question is, how do people know what their teeth are going to look like when it's all done? Like, how do you design the teeth?
Usually what we do is we'll do a mock-up. We'll have the lab do a mock of exactly the shape, the size, and they even make them white so that the person can see. Because there's a lot of people out there and they're walking out there with these bright white veneers. They don't look very natural. Some people have them so long that they can't speak anymore. Their sounds are not.
Because I see these big teeth. Is that because what the patient asked for, or is that in the hands of the dentist, in your opinion?
I think the patient might have asked for that, but what I try to do is really encourage my patients to look at magazines, look at other people's teeth, and then we're going to choose a tooth size that's right for your face and it's right for your smile. Because another thing is, you don't want to have teeth that are so big that when you smile, all I see is your 4 front teeth. We need to make sure that everything shows and that it looks really nice and natural.
Now, we talked on the phone, and one of the things you said that when you fix somebody's smile, right, and it could be something small, that they start taking selfies and posting them on Instagram or Facebook.
Definitely. They do that so much. I mean, they really can't get out of the mirror. Even when they're sitting in the chair and I do the final reveal and here's the mirror, they can't get enough of themselves. And actually, when I'm on Facebook and Instagram and Snapchat and I see people and they're not smiling, I start looking at more of their pictures and I'm wondering, when are they going to smile? Maybe there's something wrong with their teeth. And then I look and I'm like, oh, that's just something really small that I could have fixed, and then they can smile. You know, you can only do a pouty face for so many profile pictures before it gets boring.
Since we've talked, I'm noticing certain people never smile. They smile with their mouth closed.
Yeah.
So now I'm thinking they're probably hiding something.
They probably are hiding something. And if they would just come in and say what it is that they don't like about their smile, we could fix it. And, you know, they're at home obsessing over a small space, or my tooth is out, it's tilted a little bit, or my canine, it sits up here. If you come to the dentist, I can fix it. I'm like a fixer.
And it could be affordable. I mean, it's
it definitely can be affordable.
This program right here is going to hit 26 million people. Would you say that there's over a million people that don't like their smile?
Oh, more than a million people.
That they don't smile because of their smile? I mean,
Definitely.
Because of their teeth?
Yes. Or they're smiling in a way to conceal something. So if their bottom teeth are crooked, they make sure that they smile only with their top teeth. They try to do little things to kind of conceal something. And so when we help them, they feel so much better about themselves and they really come out of their shell. In one afternoon, we can really change someone's smile. And I'm wondering, and they're wondering why they didn't do it sooner. I didn't realize it could be that fast. That's what they always tell
So
me.
with the pill, it seems like, I haven't had this oral sedation, but you just give them a pill, they relax.
Yes.
And they almost have no memory of...
They have almost no memory of it, and they're more relaxed, they're less anxious, they're not trying to pay attention to what's on my tray, what am I putting in their mouth, they're just kind of there, and really able to be just at ease. That's it. Also with the oral conscious sedation, I'm able to do a lot more in each visit. So instead of having to come back to the dentist for 1-hour visits each time, I'm able to take care of 6 months worth of dentistry in just one appointment. And it really helps with patients, they're busy. I've got a lot of patients who are involved in the industry. They've got auditions. They can't make time to come to the dentist.
Like kids. I mean, somebody with 3 kids.
Yeah.
You can't afford to go back and forth to the dentist, right?
Dentist. You got to go to soccer practice and volleyball practice, and they don't have time to come to me.
Now, you also do dentures.
Oh yeah, I do cosmetic dentures, Randy. Actually, they look so lifelike. They look so natural, so realistic. My patients who come in, they've had their same denture for about 20 years. Why? You need to update that.
Really?
And
they keep them that long?
Oh yeah, because they think, oh, you know what, it's really comfortable, or maybe I'll just go buy a little bit of adhesive from the store and I can make it feel a little bit better. But we have to update them. It's got to fit your gums and it has to fit your bone. And people don't realize that those things change as the years go on. Your bone remodels itself and maybe your denture doesn't fit the same way that it used to. That's something you need to come to the dentist for. And Randy, there are a lot of people out there and they hate their denture. The teeth are cracked. They're looking, the teeth are short. They notice when I smile, I can't see my top teeth. That's something that I can fix. And it's pretty affordable now. I got some patients, they're saying they got to go to Mexico to get a new denture. Maybe they got their first denture made in Mexico, but I can make it here and I can make it affordable. And the good thing about it is if we make you a new denture, later I can convert it into a mini dental implant supported denture. So it's something that you snap out. See, I'm even having trouble getting it off of the model, but I put in a few implants and I am able to put some snaps inside of their denture and it really just locks in.
Let me see this. So no more adhesive with this kind of a thing?
No more adhesive. I've even had some patients, they have trouble getting off this denture because it snaps in there so tight.
Okay, so this is it. Could you use their existing denture if they have
I can use their existing denture. Now, not one of those worn down dentures. It's got to be something relatively new.
And these are mini implants that you're doing?
Yes, mini dental
implants. Which are less expensive.
Less expensive, less invasive,
do they work?
Less healing time. They work.
Because some people say, Randy, the mini implants, they're not as good as regular implants.
No, they work wonders. They stay in. Patients love them. And they're able to live their life, They're eating corn on the cob and ribs, and they haven't had that in years. And back to your question about whether or not they last, they did a 10-year study on mini dental implants, and they found out that they have the same success rate as standard implants. So they really do work. People love them, and it's so much less expensive, and that's what really makes it affordable for everyday people. And I can even make it a full set of teeth that lock in and they don't come out. They're permanent.
So these mini implants, according to you, this might be the future of dentistry? Like dentures as we know them will be gone?
Yes, dentures will be gone. And people will just be having on a permanent set of teeth that are locked in with their mini dental implants.
Who knows how long that'll take? That'll probably take 50 years from now maybe, or even sooner?
No, it's happening right now. So it's the future.
Now you do something called full mouth reconstruction. Is that a dental term? And
yes.
What is it?
It's a dental term, but it just means that someone maybe has avoided the dentist for a long time. Their gums are bleeding. Their teeth are loose. Their teeth are starting to snap off at the gums. They've got cavities. They've got pain. Well, I may need to use a combination of things. We may need to do some extractions. We may need to do some root canals, some crowns, some contouring of the gums in order to build their mouth back. And that's really what we're doing. And I have some patients and they're so happy that they found us. Because we're able to really make a change in their life.
All under one roof.
All under one roof.
I keep saying that because I guess there's a new trend in dentistry where a dentist is, even though it's not a real term, but like a super specialist. They do root canals, extractions, implants.
Exactly. We do that because our patients really want to stay with us. They may want to go to the specialist. And of course, if they need to, I will send them to the specialist. But if I have the knowledge, why don't I just do it here? Where you feel comfortable with.
So this full mouth reconstruction crowd, as you call it, this is a person just with a broken down mouth.
Everything's broken down, starting to break down.
And giving them a fresh start.
And we're giving them a fresh start. Yep. I also do root canals in my office.
You know, everybody seems to be afraid of root canals. So is that like the most painful thing in dentistry? Is that why everybody's afraid of it?
That's the misconception, Randy. People think, oh, I got to get a root canal. It's going to be a lot of pain. Well, we can, I've got a license for oral conscious sedation. So I can give a person a pill. We do the root canal and it's basically painless. They don't remember what happened. You know, it's a root canal. Other things we do in the practice are Invisalign and invisible braces. So that's for the person, they've worn braces, they didn't wear their retainers, and they're just starting to see that tooth move and it's starting to bother them when they look in the mirror. That's something that if we catch it, I can move it pretty quickly and they're back to normal.
Now the lower teeth, they seem to get crooked first. Like once you get about 40 years old, it seems like those lower teeth start to move.
Yeah.
Is there any truth to that?
There is a little bit of truth to that, definitely. But we're able to step in and move those teeth back, and people love it. And it's amazing how small things can really change a person's perception of themselves. I had a patient, he came in and he had these really big spaces in between all of his teeth. And he said for years he asked his dad, you know, please let me get braces. I really want to close my spaces. And his dad said no. So he comes to me, the patient's in his 30s now, and he's like, I'm ready for braces. I want to close these spaces. And when we close the spaces, and I showed him the after, you know, we're looking in the photo, in the pictures, and he was just so excited because he said, I don't know why I didn't do this sooner. Why didn't I close these spaces? And when he looks at his old pictures, he's just wondering, oh my goodness, it was terrible. He thinks it looks so bad.
So this is a guy that never smiled before.
Not really. He didn't smile very big because he didn't want people to see those big spaces in between his teeth. So we were able to close the spaces. Now he looks like he's got perfect straight teeth. This is just a lesson in life. If you don't like something about yourself, you fix it. Because after a while, these things, they really hold you back. I also have a cousin, and she came to me. She said, you know, I don't like these spaces in my teeth, and also my teeth are starting to look a little bit yellow. And we started Invisalign. And then she was able to whiten her teeth during the Invisalign. And that really that helped her.
You do your own wisdom teeth.
I usually do my own wisdom teeth extraction.
So you've had additional training after dental school for wisdom teeth?
After dental school for wisdom teeth,
okay.
Yes. And so it's really good to start when they're younger. So if you're 18, you feel those wisdom teeth back there, they're irritating the gums, that's the best time to have them taken out.
Why?
Because we don't want them to create other issues. You know, they might make the other teeth start to be crowded, or they might end up getting a cavity on the wisdom tooth, creating this weird kind of defect on another tooth that's in front, a tooth that we actually want to keep. Because I am a general dentist and not an oral surgeon, my fees are usually much less expensive than an oral surgeon. They're numb. They're not going to be feeling any pain. If they're over 16, I can sedate them. And patients really, they have a good experience.
You know, I guess, and we're short on time, but dentistry or dental work can be expensive.
It can be, Randy, but I usually work with my patients and we'll maximize their insurance. We'll get every penny out of their insurance that we can. And for the things that aren't covered, we'll help them with financing. And I also have a membership plan in my office where a patient's going to pay for their 2 cleanings a year, their x-rays, their checkup examinations, because people think that if I don't have insurance, I can't come to the dentist.
You have like your own insurance plan.
Yeah, it's basically like a policy, a plan that I do inside of my office to help those people that don't have insurance, because they should never feel like they can't come to their 6-month checkup because they don't have insurance anymore. That's not a thing.
What do you call it in your practice?
It's my membership plan.
So your membership plan, Dr. Marshall's membership plan? Do you have a fancy name for it or anything?
My office name is New Smile Studio, so it's New Smile Studio membership plan.
Which is kind of like insurance. You
it's kind of like insurance.
Like legally maybe can't call it insurance, but it sounds like insurance to me.
You can't call it insurance legally, but
it is insurance in a way.
But it is, yeah, because they're paying a fee one time and they're coming in to get their 6-month appointment. And they get the necessary x-rays that they need. They also get an examination, two checkup examinations. And let's say they have an emergency. Something happened, suddenly they're feeling pain, a tooth broke, whatever that is, that's also covered with it. And so people are really starting to gravitate towards that because they want to have some sense of security. that they're not just going to walk in and someone's going to write them this large treatment plan.
So things can be affordable.
It can definitely be affordable.
We are out of time, but final message to somebody watching this, maybe they haven't been to the dentist, as you say, in 8 or 10 years. They have like bleeding gums, bad breath, broken down mouths, but maybe they're fear of the dentist, or like everybody else, they don't want to go to the dentist. What do you say to them?
So my final message to those
Or expense,
patients
like
is,
they're worried about money. I'm sorry, go ahead.
My final message is, don't let your fear of the dentist hold you back. At least come in, let's do an examination, let's get a plan. Because we could start with something small. Maybe that's starting with the cleaning. Or maybe you need to get a lot of things done at once, and I can give you a pill, you'll be sedated, and it'll move a lot faster. The process will move a lot faster for you. I don't like to harp on the past. So, what's done is done. And let's start from today. What can we do today to make a little bit of progress, to get their mouth back healthy? That's my final message.
I want to thank you for coming on the show.
Thank you.
A real pleasure. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez.